come in here who have issues regarding their knees. And what's happening with these folks is they're having pain in the knees when they get up out of a chair. Now this isn't a chair, it's a plyo box, but they're having pain in the knees when they're getting out of a chair. So how do you fix that? How do you fix this pain getting out of the chair? Well, for one thing, what we're finding is they have bad mechanics getting out of a chair. Just like anything in life, if you're gonna pick something up off the floor or get something out of a cupboard, you know, a technique and form comes into play. Just like if you're going to the gym, if you're gonna deadlift something or do a bench press, there's good technique and there's bad technique. And what we're finding with these folks is we're finding a lot of bad technique in getting out of a chair. So what we're seeing is this. So they're sitting in their chair like this, and what they have a tendency to do is they'll try to initiate the movement with their knee. So here they are, they're in the chair, and they initiate the movement with their knee, and man, it's kind of hard to get up from this position, just like this. So here's a side view, and they initiate the movement, you know, with their knee, and they're like this, and they're having pain in the knee. Well, there's a technique that you can do to get out of a chair. Well, first of all, you need to find a stable hip. So another thing we find too is they're initiating the movement with the knee, and they're kind of buckling in. See this? So they're buckling in, they're sitting like this, and they have a tendency to initiate the movement with the knee, and they buckle in like this. And that is an unstable hip to push from. So there's two steps to this. If you want to achieve no pain with getting out of a chair, you need to do two things. First, you need to create a stable hip. And how do you do that? You need to open up the hips here, just like this. So you're going to open up the hips, and then you're going to initiate the movement with your hips and not with your knee. So you're going to bend over first, like you're going to do a deadlift. You're going to hip hinge at the hip. So now I'm loading my glutes and my hamstrings here, and then I come up from there. Side view, I'm sitting in my chair, and I shove my knees out, and I'm going to hip hinge. See this? And now I'm loading my glute, the big movers of my hips, the glutes, the hamstrings, and then I'm going to come up from here. And you can see how my shins are vertical here. I'm not doing a whole lot of movement with my knee. It's all here. See this? Hip, 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 hip. Hardly any movement in the knee. See that? And then to sit down, you just need to do the reverse. Again, initiate the movement with the hip. Stick the butt out. See that? I'm hip hinging, and then I sit down. There you go. So, again, two things we're finding with these folks. They're initiating the movement with their knee. They're initiating the movement with their knee, and it's causing pain in the knee. Or they're also buckling in, or their their hips aren't shoved out. So then what happens is they're coming up like this with the knee sometimes buckling inward, and they're having pain in the knee. So again, two steps, one more time. You're going to shove the knees out to create a stable hip. You're going to hip hinge to, see that? Hinging at the hips to open up the hips. You're going to hit the hip hinge, and then you're going to initiate the movement with your hips. And then the reverse of that is seated down. You're gonna hip hinge again to sit down. Hip hinge, and then slowly descend into the chair. Side view. Shove the knees out. You're gonna hip hinge. See that? So I'm loading the glutes and the hamstrings. See how my shins are relatively vertical here? And then come up. See now, these are loaded right here. It's the hip That's initiating the movement, boom. It's almost like a deadlift, see? Deadlift, see that? That's a deadlift. And then the reverse, to sit down, you're gonna initiate the movement with your hip and not your knee. See? See, look at this. Hip hinge, my knee is straight, hip hinge. Get this loaded, and now, see that? Boom. Hardly any movement in the knee with this movement. Versus here, that's hard for me to do. They initiate the movement with their knee instead of their hip. See that? See the difference? Anyway, if you have any questions with this video, drop it off in the comment section below. We thank you for watching. We appreciate it. If you're new here, hit subscribe. And when you hit subscribe, make sure you hit that bell notification button, because that'll keep you in the loop with subsequent videos coming here in the near future. That way you can continue to move well, live well. Also, I know you know folks who are having problems, pain in the knee from getting up out of a chair. Share this with them. Just like any movement in the gym, there's good technique and bad technique. They just may be suffering from bad technique. So just those 2 simple steps, knee pain gone from getting up from the chair and getting back into the chair. So share this with them. Sharing is caring. Also, give us a thumbs up, give us a like. It lets us know you care. Anyway, we thank you for watching. We appreciate it. We'll see you next time. Take care.